What if I told you robots are better at diagnosing your symptoms than human doctors? A bombshell new study from the University of Maine just dropped, and the results are jaw-dropping. AI crushed human clinicians in accuracy and professionalism when answering over 7,000 real-world medical questions. But here's the twist. There's a critical flaw in these AI systems that could leave patients feeling colder than a hospital waiting room chair. Stick around, because by the end of this video, you'll see why your doctor's job is safer than you think, even in the age of robots. Let's break this down. Researchers compared AI-generated responses to answers from human doctors across the US and Australia. They used a massive dataset called Medica QA, thousands of real medical questions, from routine stuff like, "What's causing my rash?" to life or death scenarios. Every response was scored on accuracy, clarity, and professionalism. And guess what? AI averaged an 8 out of 10. Human doctors, they couldn't keep up. The machines were sharper, more consistent, and packed with clinical precision. But here's where things get spicy. While AI aced the facts, it bombed the feelings. Human doctors used words like people, children, and health, language that connects. AI, it stuck to cold clinical terms like treatment and management. One patient question about cancer risks got a textbook-perfect AI response, and a human reply that said, "I know this is scary, but we'll face it together." That emotional gap, it's everything. As researcher Kelly Strout puts it, healthcare professionals offer healing through sight, touch, and presence, things AI can't replicate. So yeah, robots might diagnose your flu, but would you want one holding your hand during a panic attack? Before we dive deeper, let's pause. Drop a comment right now. Would you trust an AI doctor? Smash the like button if you're Team Human and subscribe because what's coming next will blow your mind. Now, let's talk global healthcare showdowns. The study didn't just compare AI to humans, it compared the US and Australian systems. Spoiler, Australia's winning. Aussie patients reported 85% satisfaction versus 78% in the US. They wait just 15 minutes for care, while Americans sit around for 30. And get this, a routine visit costs $50 in Australia versus $200 here. But here's the kicker. Both countries scored 90% on treatment effectiveness. So why the gap? Hint, it's not just about money. Australian doctors spend more time building trust, and trust is where AI falls flat. Think about it. When you're sick, you don't just want facts, you want someone who gets you. Human doctors adjust their tone, crack jokes to ease tension, or soften their voice when delivering bad news. AI, it's stuck on neutral. One response to a mom asking about her child's fever was technically flawless, but read like an instruction manual. The human reply? "You're doing great keeping an eye on them. Let's get your little one comfortable." That's the difference between a mechanic and a healer. Here's where it gets controversial. The study's lead author, Dr. C. Matt Graham, warns, if we're not careful, AI could magnify healthcare inequalities. Why? Most AI tools are trained on data from wealthy English-speaking populations. Imagine a system that's brilliant at diagnosing conditions common in New York, but clueless about diseases rampant in rural India. Or worse, an AI that dismisses symptoms because it's never seen them in its limited data set. Scary, right? That's why Graham says we need human oversight, diverse training data, and strict regulations. Otherwise, we're building a future where robots help the privileged and leave everyone else behind. Now, let's talk burnout. Healthcare workers are drowning. Nurses pull double shifts, doctors juggle 50 patients a day. It's a pressure cooker. AI could be a lifeline. Imagine a tool that scans your blood work overnight, flags rare diseases, and hands your doctor a cheat sheet before your appointment. Or a chatbot that handles simple questions like, "Is this rash contagious?" Freeing up clinics for emergencies. But here's the catch. AI can't replace the magic of a tired doctor who still manages to smile and say, "We'll figure this out." As one nurse in the study put it, you can't automate compassion. So what's the verdict? AI isn't here to steal jobs, it's here to be the ultimate wingman. Think of it like GPS for medicine. It'll get you 90% of the way, but you still need a human to navigate the final mile. Dr. Graham says it best. Technology should enhance the humanity of medicine, not diminish it. So yes, your future checkup might involve a robot assistant, but your doctor? They'll still be the one asking about your kids, your job, your fears, the stuff that makes you you. Final question. Would you let AI diagnose you if it meant faster results? Let's fight it out in the comments. And hey, if you're still watching, you're awesome. Hit subscribe and ring the bell, because next week we're diving into how AI predicts your death date. Yes, that's a real study. Until then, stay curious, stay skeptical, and maybe give your doctor a high five.